Welcome to our video about the cognitive and emotional effects of diabetes. The cognitive and emotional impact of diabetes is extensive. Symptoms of diabetes can be severe, and it can lead to social and personal distancing, depression, and anxiety. In this article, we'll look at the cognitive and emotional effects of diabetes, as well as the possible lifelong impact. The following list highlights some of the psychological issues that are associated with diabetes. If you're worried about the effects of diabetes, it's important to learn about the available treatments and options. Cognitive deficits. Type 2 diabetes has been associated with numerous cognitive deficits, including poor mood, inability to complete tasks, and reduced educational achievement. However, many questions remain regarding the underlying mechanisms behind these issues. In the current study, the role of age, apnea, and BMI were investigated. These variables may have a direct impact on patients' cognitive function. Ultimately, it is important to identify the factors that may increase the risk for cognitive deficits. Earlier studies showed that both type 1 and type 2 diabetes are associated with poor cognitive performance. Researchers also found a link between the two conditions and abnormal brain MRIs. Cognitive deficits in diabetes may begin early in the disease process and may be exacerbated by metabolic syndrome. Among other factors, the duration of diabetes and the glycemic control of the patient's blood glucose may affect the severity and type of cognitive impairment. Regardless of the specific factors, the pathophysiology of cognitive impairment is complex and reflects multiple pathways involved in metabolic signaling. Depression. People with diabetes may be at risk for depression. Depression can affect both the physical and mental health of people with diabetes. It's important to talk to a healthcare provider about your concerns and look for ways to improve your mood and overall well-being. Your doctor can also help you develop a plan to manage your diabetes and address your mental health concerns. By working together with your healthcare provider, you can ensure the best possible outcome. In addition to examining the connection between diabetes and depression, researchers are also exploring the relationship between the two conditions. Researchers have found that people with diabetes are more likely to develop depression than their peers who do not. This relationship could be exacerbated in stressful environments, where psychological distress may contribute to worse diabetes outcomes. For example, the emergence of a potentially deadly pandemic may cause anxiety and depression among diabetics. A recent example of this is the COVID-19 virus, which spread rapidly throughout the world and resulted in 538,000 deaths. Social distancing. The study's findings have a range of implications for the care of people with diabetes, from the development of eating disorders and social distancing to changes in sleep patterns and stress. The study's cross-sectional design did not assess mental health before diabetes or a control group with no diabetes. Moreover, the sample size was relatively small, and participants were enrolled at one tertiary center. As a result, the results may have limited external validity. The study also included information on patient resources, as well as the emotional well-being of participants. Participants were asked to rate their access to information and support from several sources. Those who gave poor ratings were asked to suggest ways to improve the system. The final set of questions aimed at assessing the social network support for people with diabetes. They also asked whether patients reported having a strong support system. In addition to the above questions, the study also asked participants to rate the support they receive from their close family and friends. Anxiety. While there is no single treatment for anxiety and depression associated with diabetes, there are medications that can help. In some cases, a validated questionnaire can assess elevated anxiety in people with diabetes. Other medications, such as antidepressants, can help reduce the severity of anxiety and depression in people with diabetes. In both cases, treatment must be individualized and based on the patient's preferences and the context in which the symptoms occur. Although anxiety and depression are not directly related, they may be linked. A recent meta-analysis of studies related to diabetes and anxiety concluded that people who suffer from depression and diabetes are at increased risk of developing anxiety and other mood disorders. In addition, diabetes-specific distress can increase the risk of developing depression and anxiety. This was confirmed by a survey of Brazilian diabetes patients. Anxiety and depression have been associated with the burden of self-management, which can negatively affect one's quality of life. Stress. There are many psychological effects associated with diabetes. These affect the patient in many ways, including reduced energy levels, poor sex life, and erectile dysfunction. Diabetes is also associated with decreased sexual desire, a decrease in sex drive, and reduced libido. It is important to communicate the effects of diabetes and the emotional toll it takes. Discussing the psychological effects of diabetes can help the patient cope with their condition and avoid negative judgments about their sexual life. Depression and anxiety are also common among diabetes patients. Studies have shown that 1 in 4 people will experience depression at some point during their lives. It is even more common in people with diabetes, with up to 50% of those diagnosed experiencing depression. Depression is not simply a low mood, it's a serious mental illness that prevents the sufferer from functioning normally. Depression is linked to diabetes and affects every aspect of a person's life. Memory. An online survey of 1,754 diabetic patients found that 93% experienced memory problems in the past month. The problem was most common among patients with UF, while 54% reported QT and 35.9% experienced all 3 types of memory problems. In addition to affecting physical functioning, diabetes patients also experience problems with time, work, and emotion. This has important consequences for diabetes management. This article outlines some ways to reduce memory problems and improve insulin adherence. The researchers found that children with a previous diabetes diagnosis showed lower IQ and memory scores than children without a prior diagnosis of the condition. This association may worsen over time. This study used a large sample of diabetic patients to capture complex associations between socioeconomic status, glycemic control, and diabetes severity. Although it is not known if these results will translate into human clinical practice, they do show that patients with type 1 diabetes and a history of DKA are at risk for cognitive deficits. Executive functions. The impact of CR on executive functions was studied in people with type 2 diabetes and age. The results showed that people with diabetes performed significantly worse than their peers with no disease. Moreover, the adverse impact of diabetes on executive functions was consistent across age groups. Therefore, the relationship between CR and executive function in people with diabetes should be further explored. This study also suggests that CR may contribute to gait impairment in older adults with type 2 DM. The extent of CR was estimated through education, leisure activities, and occupation complexity. Then, patients were asked to perform tasks that assess their executive functions. Among them, the participants were tested on visual scanning, verbal fluency, and backward counting tasks. Then, data were analyzed using hierarchical multiple regression analysis to determine the weighted effect of the CR proxy on F performance. The results indicated that CR levels significantly affected all F performance, while years of education explained the largest proportion of variance. Anger. Anger can be a symptom of many different things, including diabetes. It can cause diabetics to be more moody or angry than usual, even if their blood glucose level is within normal limits. People with type 1 diabetes may even become more hostile towards technology, friends, or family members. The emotional and physical toll of diabetes can be overwhelming, so the patient may feel like he or she has no options. The stress of diabetes can also trigger emotional outbursts, and if the anger is directed toward another person, it could escalate into physical abuse. This is not healthy for anyone and is often accompanied by threatening behavior. People with diabetes should never express their anger in this way. Anger should be controlled and expressed in a healthy way, and should never be taken out on another person. Anger that turns physical should never be tolerated, and diabetes can cause severe mood swings. Displeasure. In some cases, a diabetic may experience displeasure with the intellectual effects of diabetes, such as increased anxiety, guilt, or hopelessness. These feelings, however, can interfere with a patient's natural coping mechanism, further worsening his condition. Fortunately, there are ways to deal with these negative feelings. Here are a few of them. Listed below are some ways to cope with diabetes. Thank you for watching. Please like, comment, and subscribe if this was helpful. Stay healthy and let's beat diabetes.